all in your head, so just pull yourself together and stop dwelling on it. Well, what if you couldn't? What if you weren't in control of your mind? Imagine living in your nightmares of the past. This is what life is like for someone suffering from post-traumatic stress disorder. I'd like to help you understand what this condition is, who it affects, and how it can be treated. With those goals in mind, I'll be presenting you with information from the Mayo Clinic, WebMD, and Psych Central. When PTSD was first identified, it was called battle fatigue. Today we understand that it's much more than just fatigue. It's a serious mental disorder that's caused by the experiencing of a terrifying and traumatic event. Examples of these kinds of events are sexual assaults, kidnappings, and violent attacks. These kinds of experiences can have a profoundly negative effect on the mind. It isn't unusual for people to develop related symptoms, such as nightmares, uncontrollable thoughts, and even severe anxiety. However, an individual developing PTSD may exhibit these symptoms for more than 1 month, and they may increase in severity and change over time. So now that we've talked about the what of PTSD, let's talk about the who. 70% of adults will go through some form of trauma during their lifetime. For that reason, PTSD is extremely common, but not everyone will develop it. A number of factors place you at heightened risk. If you have a mood or anxiety disorder, if you have harmful childhood experiences, if you have a family history of PTSD, you may wish to stay vigilant of your mental state after a traumatic event. Additionally, there is greater likelihood of developing PTSD if you work in a field where you often are presented with troubling circumstances. For instance, if you're an emergency personnel member or a soldier. So, what if you do develop PTSD? Well, there are a number of treatments that can help you regain control of your thoughts. These fall into 2 groups: medications and psychotherapy. When we talk about psychotherapy, we're referring to cognitive therapies and group therapies, and also EMDR, which is a process that seeks to reassociate memories using eye movement. Medications for PTSD are usually antidepressants and or antipsychotics. But the greatest chance for success when it comes to treating PTSD is the combination of both medications and therapies. This relieves stress from the mind while letting it learn how to cope with symptoms. To bring this all together, PTSD is a battle within yourself, but it's a battle you can win. I hope you can walk away with a greater understanding of what this condition is, who it affects, and how it can be treated. It definitely isn't as simple as just pull yourself together. But with proper treatment, it doesn't have to be a nightmare that you live in forever. Thank you very much.